Healthcare equity advocate Dr. Oni Blackstock is joining Yahoo Finance Live now to discuss how awareness of inequity from the pandemic can be turned into policy without reinventing the wheel. We have Yahoo Finance's health reporter Anjalee Khemlani here with that interview.
Thanks, Kristen, and welcoming into the show Dr. Oni Blackstock, who is the founder and executive director of the consultancy Health Justice. Dr. Blackstock, thank you for taking the time. There's so much to get to, and it's such a exciting time in the space of health equity with the attention coming from the Biden administration, unfortunately, as a result of the COVID pandemic. So let's start there. What have you seen in terms of interest growth, and what specifically companies are looking at right now compared to before the pandemic?
Yes, no, thank you so much for having me. The pandemic has really helped to bring to light and also amplify a number of health inequities that really existed even before the pandemic, and now really are in a place where we need to actually do something about them. So we see many companies, particularly in the healthcare space, bringing in consultants, for instance, or creating positions for diversity, equity, inclusion chairs, to begin this work in earnest in terms of figuring out how they can revamp their policies, their practices, their organizational culture to help advance equity and reduce many of the health disparities that we see.
And the health disparities, of course, linked to social disparities. And we've seen that over the years, research pointing to things like comfortable housing, access to nutritious food, as well as other items, including access to a job, access to the internet, things that are now coming up. And the federal level is taking a hard look at that. Nothing more in terms of policy changes just yet, but we are at the state level, unfortunately, seeing policy that's negatively affecting the LGBTQ community. Talk to us about that and sort of how that sort of goes in the opposite direction of what we're seeing at the federal level.
Right. Yeah. So it's been really unfortunate. We've had the stress, the collective trauma of the pandemic. And we know that before the pandemic, people who are LGBTQ had higher rates of unemployment. We see health inequities when it comes to LGBT community having higher rates of substance use, cardiovascular disease, obesity, et cetera. And so it's unfortunate now to see at the state level a number of states, actually about 33 states, pushing forward bills that would really limit protections against, in particular, people of trans experience. So we're hearing about bills that are prohibiting trans youth from engaging in sports that align with their gender identity. And then we're also seeing prohibitions put on medical providers. We saw in the state of Arkansas a bill that became law that basically prohibits healthcare providers from offering gender-affirming care to transgender adolescents.
And is there any hope that if any policy comes out at the federal level, it would supersede anything at the state level?
Yeah, I think the challenge that we've had is that there's been a lack of consistent non-discrimination policies when it comes to people who are LGBTQ. We know many activists and advocates have been pushing for the passage of the Equality Act. That act would amend the 1964 Civil Rights Act and would include sexual orientation as well as gender identity among the protected classes. We saw that bill pass the House, but it's been sitting in the Senate, and we really need to see that bill move forward and pass so that we can ensure that LGBTQ people have protections in many aspects of life, looking at employment, housing, and public accommodations, for example.
Right. And on the what can we do side, I know that you and I have talked about for a while, there's been lots of research, there's enough data to sort of inform decisions. On one hand, we have seen the rise of telehealth. It has long been deemed a fixer for many of these problems. But on the flip side, you also have barriers to good internet connection. What do we really need to do? What needs to be done in order to not reinvent the wheel on this issue and actually push health equity forward?
Yeah, well, there's a lot that needs to be done. We know for people who are LGBTQ, about 50% report having experienced discrimination by a healthcare provider, and about 75% of people who are trans or non-gender conforming, non-binary have experienced discrimination in a healthcare setting. So we need to make sure that healthcare settings are, that there's training, that they are resourced, and that they are able to provide culturally competent as well as structurally competent care to LGBTQ patients. We're also seeing, for instance, there's a company called Included Health that works with different employers to provide health care and connect LGBTQ employees to culturally competent, structurally competent providers. And so we're seeing businesses like that start to enter the market and really help employers with connecting their patients to the care that they're connecting their employees to the care that they need.
Well, definitely a step in the right direction, and looking for more of that to come. Dr. Oni Blackstock, Executive Director and Founder of Health Justice, thank you so much for joining us today. Kristen, back to you.
And Anjalee, thanks so much for bringing us that interview with Dr. Blackstock.